Hello guys, today is Sunday the 3rd of February and I just got back from church and I'm going to be starting a uni vlog today. It's not a Monday, so I'm starting today because my presentation is tomorrow, my case history presentation, which you might have seen a little bit of in the previous vlog on how I made my flashcards. I showed a little bit of my slides in that previous vlog, so today I'm going to show you guys the presentation before I do it tomorrow. I have got back from church, I'm just gonna have my lunch and then I'm going to do some practice. I'm gonna practice maybe 2 or 3 times going over the presentation, because this morning I did it for the first time under 10 minutes, because when I practiced yesterday, the first time it was 12 minutes, second time was 11 minutes, and then I did my cue cards like you saw in the previous video. I practiced it this morning before I went to church and I did it in 9 minutes. So I hope that wasn't like a fluke or something. So I'm going to try again before I go to uni. I'll practice, then I'll go to uni and study. Then when I come back in the evening, I'll practice again. But before I go to uni, I will show you guys my slides just to show you like what I did for them for my case history. And yeah, I'm gonna have my lunch now. So this is my case history presentation. I'm just gonna flip through it so you guys can see. It was a patient who came in with a 10-day history of chest pain. That's the history of presenting complaint, which just means that just taking a history, getting more detail about the pain. And then that's continued. Review of systems is where you just do a quick review of all the different systems just to make sure that there are not other concerning symptoms. And there's past medical history and surgical history, drug history and allergies, family history, social history. And then so that's the history taking part. So when you learn how to take history in med school or PA school, you would learn how to take all these different histories as part of all the history taking process. So moving on to examination findings, so you do the general inspection and the general observations. And then there were 3 exams that we did cardiovascular exam, respiratory exam and musculoskeletal exam. Then investigations, but in this case we didn't do any investigations. When I say we, I'm referring to me and the GP, so my supervisor, because this patient was a patient I saw in general during my GP placement. And you have a problem list there, that's the summary. And then differential diagnosis. I absolutely love this beating heart. When I put it there initially, it wasn't beating, because when you take it off slideshow you can see that it's not beating. So when I was trying to practice presenting and then I put it on slideshow and it was beating, the way I jumped, yeah, I was like, yes, it works, because I had given up. I didn't think it was gonna work anyway. So these are my differentials. This was the most likely differential, costochondritis, in case you're wondering, and those are the other 2. So yeah, and that's the management plan. And there you go. So this is a 10-minute presentation. I have been practicing how to do it under 10 minutes. I'm gonna do more practice now with my cue cards. If you guys remember my cue cards from the last vlog, I think it's these ones right here. I'm gonna practice with my cue cards and then I'm gonna go to uni. So I'll see you guys later.
I have found a friend in Jesus. He's everything to me. He's the fairest of 10,000 to my soul.
It is Monday morning. It's around 10:20. I need to be at uni for 11 because that's when we start. I am in one of the first groups this morning. My presentation is at 12:20 to 12:40. So we are in groups of 6, I think, throughout the day. Some people have it in the morning, some people have it in the afternoon. I just want to get it over and done with, really. So I practiced this morning again and I did it in under 10 minutes. So I did it in 9 minutes 30 seconds, which has been quite consistent. This is the 4th time I've practiced and I think I'm ready. I'm not really nervous because I know that it's formative and I can only get better because they're going to give me feedback. So that's good. There's been a delay with the tubes this morning, so some of my friends are running late. I have one of my friends who has a session at 11 as well. I don't know if she's going to be here on time. Hopefully she'll be here on time for a presentation. But yeah, I'm going to go to uni now. This is what I'm wearing, just this shirt, and I don't know if you can see, but yeah, I will see you guys soon. So this was the end of this was after my presentation, and I'm just ticking off the presentation there on the 4th. You have another one on the Friday, but I'm not in those groups because I've already done mine. So these are my other deadlines that are coming up, and I've got that EBP summative exam on the 14th of March, which I'm going to be preparing for, and I'm just listening to one of the EBP lectures right now and trying to make some notes. That's what I'm trying to do here. So those are my notes, and in pink are all the different lectures that I have to do, and those are the lectures that I've already done. So yeah, that's what I'm trying to do here. Hello guys, it's Wednesday evening. I just got back from placement and it's currently 6:54, so it's almost 7 p.m. and I'm supposed to be going to church this evening, but I'm not going to go today because just been feeling a little bit overwhelmed and I just need some me time. So after I do this update, I'm just going to have just do my Bible study, and I'm going to read a little bit, hopefully. So I'm still reading my Life Without Limits book. I'm hoping to finish this book soon so that I can read other books, because I'm that kind of person where if I don't finish reading one book, I don't want to start another one. And I've got loads of books in my bookshelf that I want to start reading. So yeah, I didn't update you guys about my presentation. I've been really bad at vlogging this week, guys. I'm so sorry. After my presentation went really well on Monday by God's grace, and they loved the beating heart. If you saw when I was showing you guys the slides and I told you guys I loved that beating heart, they absolutely loved the beating heart. I got really good feedback from that presentation. They said my case was good, and now it's just left for me to just finish writing it up, and then I will submit it next week, Friday, the 15th of February, and that's going to be one deadline out. So I've already told you guys that I've written like 90% of the write-up, so I just need to tweak things here and there, and then I'll be done. So that's that. It's a good practice for the actual formative that we have next year, which is going to be is going to count for a huge percentage of our assessments next year. So that's good. I just wanted to talk to you guys a little bit about my GP placement, about my experience so far, and what I've been how I'm finding it so far, and also some of the challenges from GP placement. Sorry, the rest of this vlog is just going to be me talking to the camera. So if you're tired of seeing me talking, then click away now. And so I'm just going to be reflecting a little bit on my GP placement. So you guys know that we started some of you may know that we started GP placement in October, so the 10th of October, and here at George's we only have GP placements in first year, and we have it all throughout the year, and we have it once every week. So every Wednesday the whole day is GP placement. So I usually go at 8:30, and I usually leave around 5:30, 6 o'clock. So the earliest I've left, I think, is 4 p.m, 4:30, but I'm usually there till 5:30, 6 o'clock. So it's usually the whole day. So yeah, I've been really fortunate that they threw me in there right from the get-go, because they've had PA students before, so my supervisors are very open to teaching me, and not just the doctors but the nurse practitioner as well, which I shadowed her today, and she's lovely. Everyone's so lovely. They're willing to teach me. They've been really good to me, and I couldn't ask to be in a better place, in a better learning environment. Of course, everyone has their own different teaching styles, and I'm trying to get used to everyone's teaching styles. It pushes me a lot to get out of my comfort zone and I'm learning so much. The growth is just on another level. And I think one thing that I've been struggling with a little bit is because I started seeing my own patients really early, so like early November, that's when I started seeing my own patients. I've encountered so many conditions that patients have presented with in systems that we haven't been taught yet. So there's a lot of musculoskeletal conditions, neurological conditions, skin conditions, and we haven't done those systems yet. And so I've been learning a lot more outside of what they've been teaching me at uni. So for example, I've had quite a few back pains, and now I know the kind of red flags to ask about back pain, because I didn't ask them when I was taking the history, because I didn't know what to ask to rule out anything sinister. So but now I've learned that if someone comes with back pain, you need to ask about numbness, about tingling, if when they go to the toilet and wipe, do they feel it? Sorry, this is going a bit TMI, but those are the kind of questions that you need to ask to rule out any nerve damage and stuff like that. So I learned all of that in placement, learning about rheumatoid arthritis or osteoarthritis or hidradenitis suppurativa, which is a skin condition. I didn't know, we haven't done the skin yet, but I've learned that in placement because I've been seeing all these conditions, which is great. But then it means that I don't get, for some of the patients I see, when I present back to my supervisor and she asks me, okay, so what do you think is going on? In my head, I'm just like, I have no idea. And I want to say that, we haven't done this, but then I wouldn't want to say that. I would just want to go and say, okay, it may be this, and this, but I can't say that because I don't know. And that's the one thing that I've been learning, that I've only been doing this for 3 months. It's October, November, December. Yeah, so for 3 months now, almost 4 months now, I've been doing it. So I'm putting so much pressure on myself. When we've learned so much, and it's okay not to know sometimes. And the patients don't mind if you tell them, you don't know, that's fine. But as long as you take steps to then find out what's going on, then you'll be all right in the end. So sometimes I just I'm just like, I have no idea. I'll just give a vague answer, because I really don't know specifically what's going on, and that's fine. So hopefully when we start doing the systems for the rest of the year, I'll get better in terms of coming up with differentials and then thinking of like management plans on what to do. So the other thing that I was struggling with is I was talking to my supervisor last week about it, and also this week as well, speaking to a nurse practitioner about it as well, is the fact that what they present to you in PA school or med school on paper during an exam, they give you loads of clues for you to come up with what's wrong. So for example, a question might be that a patient came in with loin to groin pain, and they're feeling really nauseous, unwell, and they have they have a colicky kind of pain, so it comes and goes, and they're finding it difficult to urinate and stuff. And you start to put 2 and 2 together and say, okay, this sounds like a picture that would be a kidney stone. And then if they ask you a question that says, right, so what's the next step, what are you going to do next to help you confirm the diagnosis? Then you would know, okay, I'm going to do an ultrasound, KUB ultrasound, to confirm that it's kidney stone. So in exams they give you clues and you can put the 2 and 2 together. But when you have a real life patient in front of you, they might not always volunteer that information. You as the clinician, you need to know what you're looking for. And I was speaking to a nurse practitioner today, and she's so lovely because our roles are very similar. So physician associates and nurse practitioners, we have very similar roles, in the case that we're quite limited as compared to doctors, and we need to know like how limited we are in our role. So it was really good for her to tell me like her experience and give me some advice. She gave me some tips, which I'm going to talk to you guys about. But then what's one thing I've been struggling with is that when I have a patient in front of me, I can tend to miss certain things and miss certain questions. They don't always present like in the textbook. and they will just have loads of things going on, and I'm just sat there like, I have no idea what's wrong with you. Could it be this? Could it be this? Could it be this? And it's just trying to find like a structure in my head and working it through, saying, okay, this patient's come with breathlessness or a cough, they have chest pain as well, and tingling in their hands. What does that mean? You know, like, it's trying to put two and two together and not focusing too much on one thing, but starting wide and then narrowing it down as you get more information, rather than tunneling your vision and starting on one thing. And I've been trying to use a surgical sieve. If you've not heard about a surgical sieve, just like Google it, says the surgical sieve. It helps you in terms of thinking about diagnosis, and I've been trying to use that. I've been practicing on my summarizing and presenting back, which I'm still not really good at, but I'm getting better, hopefully, I think. And obviously just trying to be more have that diagnostic kind of thinking when I have that patient in front of me. And the tips that I got from my from the nurse practitioner today, when I was speaking to her, she was like, when you're taking a history, that you should, first of all, the two things you need to know about GP is that you need to find out what the patient's concerns are, and you need to address those concerns. You need to find out what they are and address them. Second thing is, always make sure that the patient leaves with a plan. That the patient needs to know what they're doing, what's happening next, that they need to leave with a plan. And then a history is everything. Like, a history consists of 90% of the process. If you need to take a good detailed history, because that tells you a lot. The examination, yes, tells you some things, and investigations as well, but a good history would give you a lot of clues. So you need to know the reason why you ask questions. You're not just asking questions to tick boxes. You're asking questions because you want to find out information. And the same thing goes with examinations as well. If you're doing a respiratory exam, the patient that comes in with a cough, you need to know why you're doing a respiratory exam. Or if you're doing a cardiovascular exam or a GI exam, you need to know why you're doing these things. And so it's all about thinking logically, because you're going to be responsible for these patients. I'm going to be responsible for these patients in future. I'm just a student now. I'm hiding behind that mask saying, oh, I'm only a student. But in the future, by God's grace, I'm going to have patients, you know, that I'm responsible for. And if I appear in a court of law and they ask me, why did you do this, why did you do this, or why did you not do this, I'm supposed to have a reason for why I do things. She also said not to let anyone bully you into doing something or not doing something. So you need to stick to your gut feeling, do what is right. If you think something's fishy or something doesn't feel right, go ahead and do, you know, follow your gut feeling and you know, do things that, and then justify. As long as you can justify why you're doing things, then you know that you're gonna be fine. And she said sometimes you won't know, that it's okay not to know. That's why you need to have a plan, and you need to follow through from what you've gathered, so that you will eventually know what's going on. So those are the tips that I got from the nurse practitioner today. She's really lovely. So yeah, I just, because I the reason why I've been, you know, sometimes it can be a bit discouraging. Some days are good, some days are, you know, brilliant. Like today, I thought today was brilliant. Like I had a good morning, just sat there with the nurse practitioner, we saw quite a wide range of patients. She did quite a few peak flows. And then in the afternoon I had a clinic where I talked to patients as well. That was fine. But some other days, you know, when I don't get stuff right and I just feel like, oh my God, but I know this, like I'm forgetting like all the different systems that we've done in the past, because we're learning so much more new information. Like for example, last week my supervisor asked me what are the side effects of amlodipine, which is a calcium channel blocker. If that was back in September when we were just learning about all this CVS diseases, I would have told you, you know, swollen ankles and, you know, all this other stuff, but I had forgotten. And I was looking at her, I was like, I know this, but I can't remember. And she was like, swollen ankles. I was like, yes, of course, I know this. So it's all about consolidating that information, making sure that I go back and go through those systems that we've done before. And obviously we started neuro this week, and you know, it's just on another level. And yeah, we've done so many systems so far, and it's interesting. I'm glad to learn more and more things, but you know, sometimes you just like, I just wish, that's the thing with this course, I just wish that we could just slow down a little bit, but it's very, very fast paced. And yeah, so hopefully like me just reflecting on my GP placement is helping you. I'm loving GP, by the way. I'm so glad we have it all year. I'm looking to work, I want to work in GP. That's why I'm, you know, finding out how I can become, like, get better, and you know, things that can help me in this placement. So yeah, well, I hope this helped. I'm so tired, I don't know if you guys can tell, but yeah, like I said, I'm just gonna do a Bible study, do some reading, and hopefully maybe if I finish early enough, I can finish my neurology notes that I started yesterday, and also do some writing, work on my novel for a bit before I sleep tonight. It's quite early, it's night 7:08, so the night is still young. But yeah, thank you guys so much for watching. If you have any questions, please leave them down below. Yeah, my name is Joanny, this is Love Qualified. Yeah, thank you so much for watching again. Have a lovely week and God bless. Bye. When the night is closing in, don't give up and don't give in. This won't last, it's not the end, it's not the end. You're gonna be okay.